In today's video, I show you a quick tip on how to identify a potential pain generator in patients after hip arthroplasty on MRI. Hi, my name is Chris and I'm a musculoskeletal radiologist at Arthroplasty. And in this video we focus on a specific finding on MRI that can be the pain generator for patients after hip arthroplasty, and this is very subtle, so you should know about it in order to actually depict it. So let's jump right into the case. Hello, and this is the case. Basically, this is a 70-year-old patient after hip arthroplasty. The MRI was acquired 6 months after surgery and he had persisting pain on the lateral thigh on the right side. So we assessed this here for the typical stuff, and the main thing or the quick tip that I want to show you here today is a very subtle finding that you should specifically look out for, because otherwise you will miss it. And what I mean is basically a periosteal reaction around the femur as a sign for a bony stress reaction at that location, even if you don't have a fissure or a periprosthetic fracture. So if we start at the top here, it's a little bit dark. So we scroll down and we can see there is some artifact from the arthroplasty itself here. That's nothing to worry about. But if you scroll through, we can see this high signal rim all around the bone. So it's kind of like circumferential here, this one. And you could easily just overlook it. You might think it's just a vessel, but you can see it's, if we scroll through, we can see it all the time. It's a little bit more pronounced here on the lateral aspect, and we can also see it here on the coronals actually. So this rim here, this signal increase is a periosteal reaction, and this is not normally the case. And how can you know that it's not normally the case? You basically just have your contralateral side there as well. So normally the surface of bone is very much like down here, there is nothing happening, and here we can see this edema on the surface of the bone. You can see here on the contralateral side there shouldn't be any like vessels or anything like it, and even on the axials it's nicely depicted here. If you compare both sides, you might argue, okay, potentially this is artifact, but it's not. And you can see it how it kind of like goes all the way down. It doesn't have this appearance of an artifact. It's just going all the way around. I think on this image you can nicely see it here, and there's absolutely nothing on the other side. So what is it ultimately? Basically it's a stress reaction. So this is the X-ray after also 6 months, and it's very subtle. So if we now try to find any kind of like periosteal reaction, we don't see much, right? The only really thing we see, there's a little bit of bulging here of the cortical bone, and a little bit here. So we can see from here to there, and maybe here there is a little bit of thickening of the cortical bone. And we can compare this certainly with the first post-operative radiograph. So let me just quickly load that one in. So that would be this one here, and we can just zoom into this location where we can see the whole shaft really, and maybe also here, something like this, right? So it's very subtle, and I'm not sure whether it's easy to see on the video here, depending on whether you're watching it on a mobile phone or not, but there is a clear thickening here at this location, which is not the case here. And also there's kind of like this bulging of the cortical bone here in a sense of a solid periosteal reaction, and there is absolutely nothing here. We don't see a fissure or anything like it. So this is also a sign that there is, when the patient has this stem, and you can see it's kind of like pressed against the cortical bone. If he's walking around, there is a lot of pressure that's coming, through the body down here. And it also kind of like has this distribution to the sides. So there might be just a little bit too much pressure, or just a little bit more pressure than maybe usual, or the bone is a little bit weaker to cope with this pressure, and you get these periosteal reactions here. So this is a very subtle thing, and to emphasize that it's actually true, I also can show you here the SPEC CT, which was done in addition to the MRI. And you can also see it here that there is increased uptake here at this location, where we see the bulging of the cortical bone more on the lateral side than on the medial side. To also show you a little bit of literature about this, there is a study from last year in European Journal by Lucas Fili, who is a colleague of mine, We used to work together at the Belgrade University Institution, and this is where the study is coming from, actually. So they did a very nice study where they did MRI with metal artifact reduction, like with the latest technology, and compared periprosthetic findings in asymptomatic versus symptomatic patients. And so you can go online. I put the link in the description down below and read this article. It's a very nice article and a nice study, and I just want to show you here a couple of things. So the conclusion basically is periprosthetic bone marrow edema is common after total hip arthroplasty in asymptomatic and symptomatic patients. That means in the first postoperative year you will see some bone marrow edema around the prosthesis in asymptomatic people as well. So that's not alone per se a pain generator, but it's kind of like the normal response of the bone versus the arthroplasty. And then osteolysis and certainly also periosteal reaction were more frequent in symptomatic patients. And this is relevant, right? So it's clinically relevant, although you also have periosteal reactions in some asymptomatic patients. But our patient was actually symptomatic at the exact location there. And you can see it, you can do all this study stuff and divide it into these different zones, etc. You can also see here, maybe I'll zoom in, this periosteal reaction here, all around. Nothing, and then a bit of bone marrow edema, no periosteal reaction here. So this is something that's very subtle also here on this image here, these periosteal reactions, something that we have to look out for. Obviously, because you can have it in symptomatic and asymptomatic patients, we need to have the corresponding clinical correlation. So these studies here basically just show the periosteal reaction in symptomatic and asymptomatic, asymptomatic and symptomatic, and you can have it in both locations, different locations, etc. So you can go and have a look at it here. Certainly clinical correlation is really necessary, and I think conclusion here again. So although osteolysis and periosteal reaction are more frequent in symptomatic patients, the overlap between asymptomatic and symptomatic patients does not allow to identify a specific pattern of findings which is always associated with symptoms. And this is just something to keep in mind even if you see a periosteal reaction. So ask the clinician, where is the pain, does it fit? And I think that way you can bring the answer down. But normally we don't scan asymptomatic people. It's just maybe if a patient gets, a MRI because of maybe has a tendon problem or iliopsoas bursitis and you see some periosteal reaction, it might actually be not the clinically relevant finding. Something to keep in mind. So very good study, go read it, and that's it for today. So that's it for today. So make sure you scrutinize the periost around the proximal femur in patients after hip arthroplasty on MRI. And with that, give the video a like and also make sure you subscribe if you haven't already, and see you in the next video.